Hello, my name is Zachary Warner, and for my oral case study project, we are going to talk about strokes today. So what are strokes? They're also known as cerebrovascular accidents. It's when damage to the brain due to lack of oxygen and nutrients, which causes major cell death in the brain. There's only two main arteries that nourish the brain. It's the carotid artery and the vertebral artery. And a stroke can happen one of two ways, either ischemic or through a hemorrhage. An ischemic stroke occurs when arteries to the brain become narrowed or completely blocked. Now, this is the most common type out of the two strokes. It happens about 88% of the time. And there are two different types of ischemic strokes. It's called a thrombotic stroke, which is when a blood clot forms in the brain itself. And then there's an embolic stroke, which is when the blood clot is formed away from the brain, and like in the heart, and then it's moved through the cardiovascular system and ends up in the brain, which then causes a stroke. A hemorrhage stroke occurs when the blood vessel in the brain leaks or ruptures. This is the lesser of the two, common-wise. It only happens about 12% of the time. There are two different types of hemorrhage strokes. One is intracerebral, which is when the blood vessel in the actual brain bursts. And then there's subarachnoid, where the artery bursts in the space between the skull and the brain, and then the blood goes on the brain. So the scope of strokes, approximately there's 795,000 strokes a year. And out of these 795,000, 3/4 of all these strokes affect individuals older than 65. So the majority of the older population is at a higher risk for this. A stroke occurs every 40 seconds in the United States, and only 20% of all strokes are fatal. So luckily with fast medical times, we can reduce this death rate. And it's the third leading cause of death in the entire United States. So for symptoms of a stroke, it typically only affects one side of your body. So if the stroke is happening on the left side due to the nerve crossover effect, it'll happen on the right side. And it's easily remembered with the acronym FAST, which stands for face drooping, arm weakness, slurred speech, and then time to call 911. Other symptoms of stroke includes difficulty seeing, loss of balance, a sudden headache, dizziness, trouble walking, especially the sudden headache with the hemorrhage strokes. It is a really common cause. And like I said before, whichever the side of the brain is affected, the opposite side of the body is affected due to that crossover effect. So there are many risk factors of strokes. Some can be controlled and some can't. So age, obviously the older you are, like this age group above 65, you're going to be more susceptible to stroke. Race, African Americans are tendency to have a higher risk of stroke than non-African Americans. Gender, women are more likely to have a stroke and more likely to die from a stroke, so that's concerning. Smoking, if you're a smoker, you have a higher chance of having a stroke because smoking causes you to have higher blood pressure. A poor diet is another risk factor of stroke, and a poor diet can lead to hypertension, which is just a fancy word for high blood pressure. Diabetes, which is when you're insulin resistant and you have too much sugar in your bloodstream for too long, and high cholesterol levels, which can cause atherosclerosis, which can cause a stroke. Physical inactivity is another risk factor, and also if you have a family history of it, you have a greater chance of having a stroke. So here are two studies that were done on strokes. The first one on the left is the incidence of strokes across the world. It's saying that younger people are developing strokes, and there are more deaths coming and projected in the future because of high blood pressure, obesity, the physical inactivity, because now we're in a time that our jobs aren't so physically demanding, so we're sitting for most of the day. Our leisure activity is sitting, like watching Netflix. And the second one is from the National Institute of Health. It tells what are the main funders, things that they fund, and it shows that stroke is the third most funded heart disease, which is fitting because it's the third leading cause of death in America. Management treatment of stroke, it all depends on the severity. People have different ranges of how much is affected depending on the situation, how long it takes them to get treated medically. The best way to treat a stroke is to work on lowering blood pressure through controlling blood sugar levels through diet and exercise. That is essential. Getting out there and being more physically active, going on walks, anything that you can do that will lower your blood pressure. Exercise is medicine. We're taught that every day. So it's really important that we follow through with that. Diet, obviously, it lowers cholesterol levels, blood pressure. With that lowering of blood pressure, that's really good for preventing another stroke from happening. Another main thing is taking medications. There's different medications that you can take that'll lower your blood pressure levels, like using an antihypertensive, like a diuretic, which is just to make you go to the bathroom more. Or there's also medications like warfarin and aspirin, which either lowers your platelet activity, which platelets are the things in your blood that help make your blood clot. So having aspirin will actually lower that activity of the platelets, or the warfarin, which also helps to resist blood clotting, which would lower blood pressure. And this chart shows the effects that using multiple medications to lower blood pressure is more effective than just using one. There's also, you can surgically treat it. Typically there's two ways to do that surgically, either through balloon angioplasty or stent angioplasty, which is basically, as the picture shows, they put a catheter in your blood vessel that's clogged, and then they blow up a balloon to crush the plaque against the wall so that there's excess blood flow to go through, and then they pull that out, or with the stent they leave in like a metal mesh in there to prevent it from closing again. There's also, you can use the three most common types of therapy to help this. Speech therapy, essentially, because with the face drooping, they lose the ability to talk, to swallow, which are essential for our society. Physical therapy to get them to walk again, which is important to have their independence. And occupational for their daily living, like buttoning their shirt, to brushing their teeth. All these things are super important. We're going to look at my friend George here. He's 89 years old. His BMI is 21, which is pretty good. He suffered from stroke 2 years ago, and it happened on the right side of his brain, so it actually affected the left side of his body. He has some trouble walking. His foot drags for sure, and that makes him a fall risk. He's on blood pressure medication, so lowers blood pressure, and he has a family history of stroke. He does live on his own, so he has a fairly active lifestyle. He likes to go out in his garden, and he likes to do yard work, even though he is 89-year-old. He used to be a smoker, but he quit after having the stroke because he realized the risk of smoking on stroke. His blood pressure levels with this medication is fairly good, 110/60. His total cholesterol level is fairly good. He has a decent diet, 160. And his blood glucose fasting level is 90, which is excellent. His goal after the stroke was to get back into gardening with his grandkids, because that's his passion, to be involved in their lives. So his exercise prescription, aerobic training, 5 days a week for 30 minutes a day, of moderate intensity, and work up. You want to do low impact activities because he is an older individual, so it would be hard on his joints to do constant, like, running hard on his leg. You want to utilize the large muscle groups to maximize time. You want to have rails and chair to support if the subject gets tired, and like maybe a harness or something. Just extra precautions in case they get tired. Strength training, 4 days a week, light intensity at first. You want to affect on his left side because that is the affected side, so it is weaker. You want to gradually increase that to match the strong side, and then you want to do especially exercises that help with balance. You don't want to cause an imbalance in these individuals, and using machines are good for rehabilitation because they isolate the muscles that are affected. Flexibility, it's super important. 5 days a week, and they're supposed to stretch until they feel tightness because as you age, it's really important to maintain your flexibility to be able to reach over and reach up and over things. And most importantly, neuromuscular training, that is 3+ days a week. Focus on the balance because he's a fall risk, especially after having the stroke, and focus on those functional tests that help with the activities of daily living. Special considerations. The individual should not exercise if they had a heart attack within the past month or they have chest pain within the past month, and make sure that they're under close supervision all the time because they are a high risk. And as this picture shows, have equipment with extra safety against falling because that would make their situation a lot worse. For more information, you can go to one of these 3 places: the National Stroke Association, the American Stroke Association, and the Center for Disease Controls and Prevention. They're all great places. And that is it. Thank you for your time.